Hi everyone and welcome to another obscure Asian story.
In South Korea, over 12,000 doctors from more than 100 hospitals have gone on strike since February. They are protesting a government policy to increase medical school admissions. The strike initially involved medical students, interns, and resident doctors, but senior doctors and professors later joined in solidarity. While this represents only a fraction of the estimated 140,000 doctors in South Korea, the strike has already led to the cancellation of hundreds of surgeries and other treatments. The healthcare sector in South Korea faces challenges related to salaries and working conditions, and previous attempts at compromise failed. The situation remains tense, with President Yoon Suk-yeol clashing with thousands of striking assistant doctors. Well, how did everything start? After the government announced its medical school admission policy on February the 20th, thousands of resident doctors in South Korea resigned from their positions and began a strike, significantly impacting healthcare services. In major hospitals, resident doctors constitute 30 to 40% of the total number of physicians. Emergency rooms were crowded and surgeries were being postponed. To stabilize the system, the Ministry of Health has allowed selected nurses to take on medical tasks, and military hospitals have opened their emergency departments. However, these measures are insufficient to adequately treat all patients. Despite the strike, Yoon has not been deterred and has not approached the doctors. A significant portion of the population originally supported increasing the number of medical school slots because South Korea faces a chronic shortage of doctors.
이런 환자들의 치료가 지연되고 있고
There are news reports about the delayed treatment of patients, and the fact that this situation could drag on is deeply disheartening and frustrating for patients in severe conditions and their family members who rely on surgery or cancer treatments.
On average, there are 2.6 doctors per 1,000 residents, whereas in countries such as Germany, the average is nearly twice as high. The doctor shortage is particularly noticeable in rural areas, as most doctors are drawn to the metropolitan area around Seoul. Additionally, many doctors specialize in more lucrative fields such as plastic surgery, dermatology, and ophthalmology, while emergency medicine, general practice, and pediatricians are in short supply. Given the rapidly aging population, Korea will likely need even more physicians in the future. As a first disaster response, the Ministry of Health and Welfare in South Korea made the decision on February 23rd to permit all clinics and treatment centers to offer telemedicine services, a practice previously deemed illegal due to a contentious doctor strike in 2014. This move was a significant shift, as telemedicine had only been allowed in limited cases during the COVID-19 pandemic. On February 26th, a wave of resignations hit the medical community. Out of 100 hospitals, 10,034 interns and resident doctors submitted their resignation letters, with 9,006 resigning. The ministry reacted by suspending the medical licenses of two leaders of the Korea Medical Association and ordering 6,228 intern doctors to return to work. The government promised no punishment for those who resumed their duties by February 29th. However, by March 1st, 565 doctors had not returned, prompting the government to threaten administrative sanctions and possible judicial measures. To manage the crisis, the ministry classified patients into critical and non-critical groups, ensuring that regional emergency centers could handle severe cases. Doctors who had not returned to work were warned of impending punishments. Non-compliance would result in a suspension of their medical licenses for at least 3 months, delaying their qualification as medical doctors by over a year. Additional administrative sanctions would also be recorded in their employment records. By March 8, 11,994 intern and resident doctors, representing 92% of trainee doctors, remained absent. The ministry issued a notice of suspension of medical licenses to 5,566 of these doctors on March 11th, promising leniency to those who returned to work before the completion of the notification process. On March 9th, medical schools reported receiving 5,445 applications. By March 11th, the government announced the deployment of military doctors and doctors from public health clinics to hospitals affected by the strike. On March 16th, senior doctors and professors from 20 hospitals threatened to submit their resignation letters. They began reducing their practice hours. In early April, President Yoon Suk-yeol took a step towards the doctors and signaled the possibility of negotiations. However, he seemed determined to stick to the increase of 2,000 study places. He reaffirmed his intention to expand medical schools admissions and sought public support. He expressed regret for not being able to promptly address public inconvenience and stated that the country faces a shortage of medical doctors. Despite the government's announcement to revoke their licenses for a year, only a few hundred assistant doctors returned to their temporary workplaces. On May 1st, the South Korean government reduced the increasing quota of medical school admissions from 2,000 to 1,500 for one upcoming academic year. This decision was made after receiving updated numbers from the universities who wanted to shrink the quota to minimize the conflict between the medical school professors and other faculty members. However, the Korea Medical Association residents and interns maintained their stance. On May 16, the High Court of South Korea ruled that increasing the quota of medical schools is necessary for the greater good. The striking doctors suffered a significant legal setback when the Seoul High Court rejected their request to block the government plan. On May 18, the South Korean government issued a return-to-work order for private practitioners as more doctors, including medical professors, joined the month-long strike to protest increasingly medical school admissions. In early June, South Korean officials once again issued return-to-work orders for doctors participating in a one-day walkout as part of a protracted strike against the government's plan to sharply boost medical school admissions. Many rejected the plan, set to begin next year, saying schools wouldn't be able to handle the increased flow and that the quality of the country's medical services would suffer. About 4% of the country's 36,000 private medical facilities, categorized as clinics, have told authorities they would participate in a one-day strike. This came a day after hundreds of medical school professors at 4 major hospitals affiliated with Seoul National University entered an indefinite walkout, raising concerns about disruptions in medical services. South Korean Deputy Health Minister Jeon Byung-hwang said the one-day strike by clinics and the walkout by SNU-affiliated medical professors haven't immediately caused significant problems in medical services.
국민의 생명권은 그 어떤 경우에도 보호되어야 할 기본권 중에서도 가장 기본적인 권리입니다. 정부는
He accused the protracted strike of threatening to destroy a trusting relationship between doctors and patients our society has built for long. He emphasized that doctors must uphold their end of professional and ethical responsibilities and legal obligations under the medical law. As of July 18, 2024, only a small fraction of the 12,000 resident doctors who had resigned in protest had returned to work. Their terminations were finalized on July 15, allowing them to seek employment elsewhere. However, Park Dan, the head of the Korean Intern Resident Association, accused hospital directors of hindering these doctors' re-employment efforts. South Korea's healthcare system, known for its affordability, is facing constraints. Many doctors report feeling overwhelmed due to long working hours and low pay. They argue that the system favors specializations like dermatology, which are not essential for most people's everyday health. Despite these challenges, South Korea's medical system has been recognized globally, ranking second in an international healthcare index in 2024. The country also exports its medical expertise, including traditional Korean medicine, training programs, and academic exchanges. Regular public health checks are provided free of charge for citizens and long-term residents, and the cost of doctor visits and basic prescription medicines is relatively low. However, the rapidly aging population has sparked a debate over whether the current number of doctors is sufficient. Research suggests that South Korea may need up to 27,000 more doctors by 2035 to meet demand. The distribution of doctors across urban and rural areas is uneven, with 3 physicians per 1,000 residents in cities compared to 1.6 in rural areas. Doctors are reluctant to practice in rural areas due to concerns about children's education and difficulties living away from family. The distribution of physicians across specializations is also uneven, with a surge in the number of cosmetic surgeons and dermatologists over the last decade. In 2016, the annual admissions into South Korea's medical schools were capped at 3,058. In 2020, the government proposed raising this by 400 places a year to address a shortage of physicians. Doctors opposed the proposal and went on strike, fearing a decrease in their revenue share. Amid the COVID-19 pandemic, the government conceded and doctors returned to work after a month-long strike, preventing an increase in the supply of physicians. The proposal of President Yoon Suk-yeol's administration was obviously met with strong opposition from doctors who had previously rejected a smaller increase in 2020. South Korea has been grappling with a shortage of doctors, particularly outside of Seoul, for years. The Doctors Association, wielding significant political power, has resisted efforts to meet staffing demands in order to maintain high wages. Doctors burdened with long work hours and understaffing have gone on strike to protect their financial interests. They fear that an influx of doctors would introduce competition and lower medical costs for Koreans. However, South Korea is facing a rapidly aging society. It is poised to be the world's most aged nation by 2044, and the government claims this demographic trend requires a bolstered workforce. Private health insurance companies are set to benefit most from these policy changes, with their stock prices soaring. They will soon also be able to automatically collect all records of doctor visits, providing more opportunities to deny coverage or refuse payment. Ironically, doctors, who as a political bloc helped bring this conservative administration to power, did not anticipate these changes. South Korea has a low doctor per capita ratio compared to other developed nations. However, the simple numerical comparison overlooks broader considerations. South Korea operates on a fee-for-service model, unlike many OECD countries that use a capitation model. In a capitation system, physicians' loads are restricted, necessitating a larger number of doctors to meet demand. South Korea also boasts the highest annual outpatient treatment rate, approximately 3 times higher than the OECD average. Despite the current numbers, the country maintains exceptional healthcare accessibility. Patients consult doctors even with minor symptoms without delay. One concern in the medical profession is that medical schools do not have the capacity to accommodate an increase of 2,000 more students per year. Once they complete their residency, many doctors move back to Seoul and specialize in fields like plastic surgery or dermatology, which won't address the issues the government is targeting. The doctors on strike are mostly young and at the greatest risk of job loss from the strike. Those leading the strike and controlling the doctors' associations are older, established, and have kept their clinics open during the strike. Critics accuse these young doctors of primarily fearing competition and income losses, even though doctors in South Korea earn well above the average. The proposal has been warmly welcomed by the private tuition sector. In Seoul, a medical school course for primary school students has already appeared, anticipating a wave of enthusiasm. Initially, most citizens supported President Yoon's hardline stance, which helped to increase his popularity ahead of crucial parliamentary elections. However, after the elections, his approval rating sank to the lowest of his presidency. The protracted stalemate shows no signs of resolution, and public opinion has turned against the government. A majority of respondents in a recent poll said that the government should negotiate with the doctors to reach an agreement quickly or withdraw its proposal. For weeks, neither side has budged. South Korean law stipulates that doctors who defy return-to-work orders can face license suspensions or other penalties. The government plans to take legal action against hospitals that cancel reserved treatments without prior notice to patients. Hospitals that fail to adequately respond to the walkouts may face disadvantages in health insurance compensation. President Yoon Suk-yeol expressed regret over the prolonged strike and warned of stern responses to any illegal activities that abandon patients. Despite the strike involving only a fraction of South Korea's 150,000 doctors, it has led to numerous cancellations of surgeries and other treatments at large hospitals, which rely heavily on junior doctors and trainees. The government initially threatened to suspend the licenses of striking doctors, but later paused these administrative steps to facilitate dialogue. The government made its first concession by offering to scale down its original proposal by as much as 50% for the next school year. However, more than 10,000 residents and interns crucial to the operation of large hospitals remain off duty. Emergency room doctors have long complained about being overwhelmed by patients with minor injuries or illnesses, a strain that seems to have intensified during the doctors' walkout. At least 2 emergency care deaths were initially attributed to the strike in local media, but the health ministry denied these claims. The Yoon administration believes that increasing medical school enrollment will lead to more physicians in rural areas and understaffed medical specialties. However, critics argue that this assumption lacks empirical evidence and could exacerbate the concentration of doctors in Seoul and other metropolitan cities. Instead of hasty reforms, critics suggest that the government should address the root issues and enhance the appeal of rural areas for physicians. They propose raising government-mandated medical fees for practitioners in fields with low medical costs and extensive insurance coverage. South Korea's national healthcare system is designed to cover up to 80% of inpatient and 30 to 70% of outpatient medical services. However, there is a significant disparity in the government-mandated medical costs between essential and non-essential healthcare fields. Essential healthcare fields face understaffing and lower popularity among doctors compared to more popular but non-essential specializations like plastic surgery and dermatology. Addressing the issue of attracting doctors to rural areas requires resourcefulness and creativity from policymakers. Critical infrastructures are sparse in rural areas today, from local pharmacies to gas stations, grocery stores, and diners. Policymakers need to rejuvenate these regions, enticing not only more medical professionals, but also residents and businesses.
I hope you enjoyed this video. See you next time and thanks for watching!